Thank you for being with me today. Why don't you give us a little rundown of your education at Concordia and then how that journey has gotten you to where you are today?
Yeah, so I graduated from Concordia a long time ago. We'll just say that. No, I think actually my first year, it was like the first laptop-based campus in the cities. So we all had laptops and we thought that was really cool. And now just laptops are just a thing for everybody. Anyway, yeah, I majored in kines. My intent was to go to physical therapy school. So I was a kines major, also did a minor in sports psychology, and actually got my coaching certificate just because a lot of the classes crossed over. And I mean, if it wasn't for Concordia and just the family feeling of the school, I would not be where I am today. Um, Dr. Lamont, who was my advisor at the time, and I know he's moved up, he was so helpful and just, even at the time, just, innovative and just far beyond his time, talking about autogenic relaxation and things that a lot of people weren't talking about at that time. And Dr. Chapman, who was the vice president at that time, was very, very supportive. And so they helped me through a lot. And of course, the track team, that was another little family. I think we had just gone from NAIA to Division II as well. So a lot of transitions, but a lot of fun. And so I detoured a little bit. I did not go straight into physical therapy school. But to make a long story short, I came back around, decided to go to nursing school, and then got a Master's of Science in Nursing, which gave me my nurse practitioner degree. And here I am, I'm able to use my kines education for, a lot of things with my patients who are struggling with maybe, getting back into shape or wanting to exercise, some nutrition stuff. As I was sharing with you before, I also coach a track and field club. I'm an assistant coach. And although many things have changed, we've learned a lot about the body and different things since then. There are still a lot of things that are the same. And so I'm able to help these student athletes really with some of their mechanics and, just performance and even some sports psychology stuff
Yeah.
to them improve. Yeah.
Yes, totally. And tell us what a typical day looks like at your job. So you now own a business and see patients. So tell us, I guess, number one, how you got to that, because that is a endeavor on its own. However, we might have some entrepreneurial students watching this video. So how'd you get there? And then what is your business? How are you supporting people? What does that look like?
Yeah, so I started practicing as a nurse practitioner in 2015, and I worked at a couple different places. And I moved back to Minnesota in 2018, and I just couldn't find anything that really fit what I was looking for. And I remember my dad telling me, "Hey, you can't have everything you want." And I was like, "Yes, I can. I just may have to create it." And so lo and behold, Nexus was born from there. It was definitely more than I thought it would be. People with the shortage of mental health care, it was not hard to start getting patients. However, I didn't really have a business background. And so I would encourage anybody, if you are interested in running any sort of business, whether it's corporate, whether it's healthcare related, just take some business classes, link up with your small business administration office, something, because we had to play catch up with a lot of different things. So yeah, so that started in 2019, and it was just me. And I started just like in a single room. And now we've grown to, oh my gosh, 5 nurse practitioners total, with some more people coming on that work remotely in an office. And then 4 admin staff, supportive staff members in the office. We are located in Lakeville. And yeah, a typical day is I get up, I look at my calendar, I see which patients, I have on my schedule, if there are any new patients, if there are follow-ups. I just kind of familiarize myself with who I'm going to see. I do a lot of meditating. I've incorporated that into my life. And so one of the things I start off with is just, asking the universe to help me, touch everybody individually. You know what I'm saying? I guess that sounded, you don't say touch.
Yeah, no,
Reach,
totally.
reach everybody individually. Do, be able to say something that speaks directly to something that is going on with them. I think a lot of mental health care and skills really comes down to intuition and listening to people, to what they're saying and what maybe they're not saying, looking at patterns, and then being vulnerable as an individual and using self-disclosure to where it's therapeutic. There's obviously always boundaries, but especially in this day and age, people want to know that there's nothing wrong with them. Everybody's struggling with something. There's no such thing as normal. And, we're just all here trying to get through life as healthy, as healthily, is that a word? Healthily as possible. I didn't major in English, so.
That's a good adverb. I think that's a good adverb.
Yeah.
And I read a few stories about you in the popular press, but you have looked for a opportunity to support specifically women of color. Is that the group you look toward? Who's your clientele?
Clientele's everybody. I would say really anybody with trauma, which can be everybody. Yeah. But there's a lot of people that don't realize they have trauma, I guess. And so it's very, very fulfilling to help people realize that, no, you do have some trauma, even though you may not think it. And this is how we're going to work through this to help advance your life. There's a special connection with women of color, and then being first generation Nigerian. My parents were both born in Nigeria. Unfortunately, women of color, BIPOC communities, immigrants, still our relationship with mental health is still not the greatest. And so even though I may not have a lot of these people coming to me to get treated, I'm still looked at as an expert in the community. And so I have a lot of people that may just ask me questions or get some information. And I can say, okay, yeah, that's accurate, or that's not quite accurate. Maybe let's think about it like this. My parents are pretty well known in the community, and we've gone through some life trauma and difficulties and tragedies ourselves. And so I'm able to talk with them about things that are going on, and then they can relate that to their peers who are dealing with difficult mental health situations. So,
how would you say how do you see the marriage of disciplines between nursing, psychiatry, mental health skills, and then kinesiology, exercise science as a whole? So you come at it with kind of tendrils in a few different areas, so that hopefully helps make you a very holistic support person. But talk about the importance of those differing ideas coming together.
Yeah, so just like you said, approaching this from a holistic point. I've had some patients that come in and like, you don't need meds, you just need a different job. Or you don't need meds, you and your partner need therapy, or maybe you guys really shouldn't be together. So you have to look at different things that are going on in somebody's life, and so, if you're exercising more, and I know that I need to do this for myself, right, that increases your serotonin level. So like going to, neurotransmitters on a biological level. Exercise equals more serotonin equals a better mood. So you're less likely to need antidepressants, or, less likely to need, higher doses, because you are improving your mental health, biologically. Exercising, and other things, nursing, it's a lot of, advocating for our patients and education and making people feel validated, which I said before is very important for people feeling like I can be vulnerable and I can be open with my provider and really tell them everything that's going on, instead of trying to hide it or minimize things because they're afraid they'll be judged. So like I said, listening to what the patients are saying and what they're not saying, you know, is very, very important. Yeah, it's so I take a little bit, you know, take a little bit of everything, like you said, like everything, all of my healthcare related degrees all merged together, and depending on what somebody needs, you know, I just, like you said, pick a little here, pick a little bit there, you know, whatever's applicable, and then here we go.
Yes, and there's a synergy to that for sure. So a lot of students watching this may be thinking, you know, the physical therapy route or the athletic training route or the coaching route. However, your route was a little circuitous. So let's go to a personal level. When you were that senior student sitting in class and maybe listening to guest speakers or thinking you had that physical therapy route chosen, what do you now reflect on from your own personal journey? And not mistakes, but just things you learned along the way that nobody told you, that you kind of discovered for yourself?
So that didn't really happen. I decided my junior year that I was actually going to go to film school, is what happened. And so what was very, very helpful at the time, like I said, Dr. Lamont and everybody, they were very supportive and let me adjust things so I didn't have to go back and start, you know, another major or lose some time, and to still, you know, meld both of those things. But thinking about just in general, I thought I wanted to be a physical therapist, and I'd actually never worked or shadowed a physical therapist.
Sure.
And so one of the things that happened is my senior year, I tore my ACL and posterolateral corner injury. And then as I was healing, I was working with a physical therapist, and I was like, this guy's horrible. This is not what I want to do. You know, like I don't like this. And so I had already pivoted, but not for that reason. So I would definitely say shadow, ask a lot of questions, shadow different, you know, people in whatever discipline or whatever field you think you're going to go into, because one person might, you know, work things another way, person might work things another way. You know, look at people that work for their own clinics versus people that may work for a hospital system, because that's different. And you'll find where you fit the best once you shadow, you know, versus just, you know, getting to DPT school or whatnot, and then getting into your clinicals and you're like, oh crap, this is what is going on. And I had no idea. So yeah, that's one of the things I would definitely recommend.
Yeah. Going back to a professional lens, talk to us about what you are reading, what you're seeing at conferences, what research is showing, where do you see your practice or, you know, medicine 3.0 going in the next 10 years, if you have a professional opinion or a personal opinion on that?
Yeah, it's all kind of the same. I think more and more people are looking for holistic, you know, care that looks at all facets of their lives. People are also looking, I think, for more non-invasive treatments, or I don't even like to say alternative, non-pharmacological interventions, you'd say in nursing school. And so one of the things that we've implemented is transcranial magnetic stimulation, which can be used to treat a myriad of emotional disorders. But you don't have to take medication. You don't get the systemic side effects. So people are really, really happy with that. I think that's where medicine is trending to go. Also with AI is making documentation a lot easier. I will say that for sure. So that will be interesting how that evolves. Like I said, making documentation very, very easy. That's probably be the bane of your practice, whoever is out there, you know, just document. Yeah. And so the easier you can make it, the better. Speaking about documentation, you know, a lot of the documentation we do is for insurance companies. And so I see a lot of private clinics or private providers going away from that and doing a cash pay or concierge model, just to be able to avoid the hoops that you have to jump through with insurance companies. I think that has pros and cons. I see the benefit of it, but at the same time, if you have insurance, you want to use it. You know, a very good family friend of mine, Thompson Adejoke, he was a founder of Nice Healthcare. And so they offer physical health plans kind of to employers and insurance companies. And I think models like that are really, really helping providers, or excuse me, employers, excuse me, keep costs down as well, health costs down. So I see more and more employers drifting to programs like that or plans like that, where, you know, people can provide different types of healthcare, you know, that aren't maybe necessarily urgent or dire,
Right.
you know, and then maybe on demand or, you know, quick access basis. Yeah.
Right. It will be interesting to see the continued evolution of what becomes, and I think what all of the classes that I teach, we have talked about, just like you said, advocating. The medical system isn't going to change unless patients and clients ask for it and demand it, really. So
yeah. Yes, for sure.
It needs to be coming from us as the consumers.
Exactly.
All right, a final question from me. If let's put the vocational hat on now. So if a student is watching this video and thinking like, that sounds great, I want to do something like that. What is going to make somebody stand apart? Or if you're sifting through 10 resumes to find somebody to join you at your clinic, what's going to stand out?
So something that's happened in the past few years because of the mental health shortage, mental health and psychiatry used to be the redheaded stepchild of medicine. And you could get into, like, if you went to med school, you know, finding a psychiatry residence was, you know, that easy. But because of the shortage and increased spotlights, and then kind of some reimbursements, bonuses or advantages, a lot of people that are going into mental health that, in my humble opinion, you know, are not passionate, excuse me, about mental health or psychiatry. Psychiatry, I believe, is one of the fields of medicine where you can still damage somebody by not even doing anything, you know, when they come to you. And so I would look for somebody that has established a pattern of being passionate about mental health care, passionate about treating people as individuals and not, you know, like, oh, this algorithm or this book says that. Then I know, you know, that takes some time as a practitioner for you to be confident in your skills and, you know, kind of have some of that outside of the box thinking. But that's what I would be looking for, because that's my point of view and my approach, you know. Like, okay, yeah, I mean, I know this may not be orthodox, but my mission and my calling is to help somebody. So if you come in here and you don't feel helped, you know, then I feel like I've wasted your time and my time. So, and this is not saying like carte blanche, just give the person whatever they want. That's not what I'm saying, you know, but, you know, I tell people that, okay, I may suggest option A and you may suggest option B. If I insist on option A, you're not going to be invested in your treatment plan and you're going to leave and you'll be like, well, forget her, you know. But if we can compromise on option C, it may not be my first option, but I know that you're going to go home and implement that option C, you know, and you and I will both know where you are and where you're going. So my number one thing I look for is people that are willing to collaborate with patients. Yeah. So
good. Any final thoughts for any students who are, maybe where you were, you know, a few years ago, or struggling with ideas, or maybe you're just being introduced to the idea of you could certainly get a degree in exercise science, continue your schooling, and then become a mental health practitioner. So any final thoughts for our students?
The sky is the limit. No, I mean, do whatever you want to do. It's 2024. And when I say whatever you want to do, I mean, there are so many options and so many things that you can do now with, you know, social media and with platforms and everything. So don't ever feel like you have to be in a box. You know, if you're a clinician, you can also be a business person. You can also speak. You can also write. You can be a coach, because, you know, there's so many things that you can do. And so don't feel like you're pigeonholing yourself by first, you know, first pursuing one thing. Yeah. So that's what I would say.